My name's Dr. Michael Talbot. I'd like to take 10 minutes today to talk about the range of weight loss surgical operations available, just to give you an idea of what people talk about when they're talking about weight loss surgery. First up, I'd like to introduce other members of the team. When you come to see us here, you won't just be seeing one people. There's a range of other specialists and medical practitioners, as well as dietitians and psychologists we have working with us here to make sure you get a good result. So why do people become severely overweight? It's a complex and emotive topic, obesity. What we do know is that many individuals carry genes that make it easy for them to gain weight. Some people don't. But if you've got those genes, it takes lifestyle changes to activate your weight problem. 30 years ago we had the same genetic profile, but obesity was uncommon. What's happened now is that we've started to eat more frequently, eat high energy foods, and our amount of incidental exercise has dropped. So this is a lifestyle problem as much as a genetic problem. So why would somebody choose bariatric surgery? It's a permanent or long-term treatment for people who see themselves as having a major long-term problem with their weight. It's not for people with a trivial or short-term problem with their weight. What we do know is that everyone who's severely overweight has the potential to lose weight, but it will take major change. How does surgery work? Well, we can't change your genes, but we can help you with eating, appetite and lifestyle. So surgery changes your desire to eat high energy foods for about 9 to 18 months and limits how much you can eat. While your meals will always be limited after this sort of surgery, most people develop the ability to eat more as the stomach softens and recovers its function. And more importantly, they may develop the habits of snacking or high energy liquid consumption, which led to their weight problem in the first place. So these are things we work on after surgery. So I often get people talking about diets. We don't like the idea of diets, but we do like the idea of limiting junk foods and high energy foods. Any fresh, unprocessed food is fine. If you want to keep your weight off, you'll have to avoid snacking, grazing, or comfort eating, which is something that a lot of people do and seem to get away with. So I'd like to talk about the concept of snack foods and discretionary calories. We know that the average Australian consumes 400 calories per day of non-food calories. If somebody has a weight loss operation and goes back to eating non-food calories, then weight gain is pretty much guaranteed, and it's these sorts of foods which lead to weight problems with most of our patients. This is the sort of food that we want you to have. Things that grow or animal or fish protein, eggs, unprocessed foods that you've got to cook yourself. This is the ideal type of food. If somebody's got a weight problem, there's a range of options available, and what you can see is as you go from the top of the page to the bottom of the page, the chances of maintaining weight loss increase, but the risks also increase. And I'm going to go through the procedures in that order, so from low risk to high risk. A reminder of how surgery works. Because all the procedures become less powerful over time, we have to learn new skills, which is really reducing your portion size, and the surgery helps with that. Reducing meal frequency, and this is something that you have to do, and have conversations about reducing the calorie density of the foods that you eat. So how do we choose which operation to offer a particular person? Well, a lot of it depends on the person. It relates to what you want the operation to do and what you want it not to do. And for most people, this means having a conversation about risks versus benefits, and whether you're more worried about weight regain and failure to meet your goals, or worried more about risks. Generally speaking, the greater the number of medical problems you have, the less keen you are to have a procedure that might not meet your goals, and the younger and healthier you are, the more worried you are about surgical risks. I'd like to introduce here the concept of variable outcomes. If you prescribe a treatment, either a diet or a drug or an operation, you get a range of results in most people. So while it's possible to lose an enormous amount of weight with a diet, for example, only about 1 in 20 people will do this. And while it's possible to lose a disappointing amount of weight with a gastric bypass, only 1 in 20 people will lose a disappointingly small amount of weight. So most procedures have a distribution of weight loss, with most people falling in the middle, and then you get the outliers. So for an example, for a sleeve gastrectomy, the range of outcomes for a sleeve gastrectomy is 25 to 35% of your total weight being lost. So the way to think about this is if you're 120 kilograms and you lose 40% of your weight, you'll lose 50 kilograms, which is a lot. So what you'll see is that some patients will lose all the weight they want to lose, and a small percentage of patients will only lose a disappointing amount. If you get the people early who are losing less than what they should, there's a whole lot of strategies that we've got. Some people don't like the idea of something permanent, and the most effective non-permanent procedure these days is an intragastric balloon, which you place inside your stomach for 6 months. It does require endoscopy to place and remove the balloon, and there's no coverage from health funds. So the total out-of-pocket expense for these sorts of procedures are about $4,000 to $5,000 for most people. It manages, on average, 10% weight loss, and when you remove the balloon, there's a significant risk of weight regain. But between 15 and 25% of people will maintain some effect of the procedure beyond 2 years after removal. Gastric band, this used to be the most commonly performed procedure in Australia, but it's less common now. It's very safe and it's a very effective long-term option, but it's got a very high side effect profile, and this is the reason why it's become less popular. Not because it's not effective, but because of the side effect profile. And most of the side effects occur from over-adjustment. We expect people with this procedure to lose 15 to 20% of their weight, but about 1 in 5 people will lose less than 10%. You can make the gastric band a little bit more effective by adding in some extra sutures and compressing the size of the stomach. This increases the risks to similar to that of the sleeve, but it does mean that the procedure is still modifiable and partially reversible. And because the band is adjusted less, there's less side effects. It's a new procedure that's gained some popularity called the endoscopic sleeve gastroplasty. With this procedure, what we do is use sutures to make the stomach smaller, relatively similar to this last procedure but without a band. What it does is shrink the stomach down to make it look like an hourglass, and it leads to about 15 to 20% weight loss, with 1 in 5 losing under 10%. We expect this procedure is likely to work for about 2 to 5 years, but it won't be permanent because all of the sutures will eventually fall out. It's a greater risk than a band, but less than a sleeve. The laparoscopic sleeve gastrectomy really is the go-to weight loss procedure for the majority of people. What we do is reduce the stomach down from about 1¼ litres down to about the size of half a cup. After a couple of years, the stomach does stretch up to about a cup in size, but it still remains 1/5 of the size that it used to. The reason why it's the go-to procedure is because it's effective, people get rapid weight loss, and it's got the lowest side effect profile, and that's really important from a quality of life point of view. It also has the easiest post-operative management. What we have to understand is that permanent operation is not the same as permanent weight loss. A laparoscopic gastric bypass is a relatively similar procedure to a sleeve. It's permanent but reversible, and it's got more major effects and therefore more major side effects. The version of this procedure that we perform is seen on the left-hand side of the screen. It's the banded gastric bypass, and with this we place a celastic ring towards the bottom part of your new gastric pouch, which prevents the stomach from stretching and prevents the small bowel from stretching. There are other versions. such as the mini bypass or single anastomosis gastric bypass. This is relatively similar to a gastric bypass. It may not have this, it may have a slightly higher side effect profile in people having revision surgery after gastric bands, and that is a slightly higher risk of malabsorption, but it's got a real possibility for a lot of patients, and it's certainly an operation we're happy to discuss and offer. Is a more complex and larger bypass procedure that we're starting to perform called the loop duodenal switch, and this is likely to be a reasonable procedure for patients who've had weight regain after a gastric sleeve, especially if they're eating a lot of carbohydrates. This procedure makes you intolerant to carbohydrates, so if you snack a lot on breads or biscuits, etc., this might be the ideal operation for you. A major side effect from it, though, is the risk of malabsorption, so there are greater risks of requiring complex multivitamin supplementation. If you want to put all of the procedures on a table and look at their risks, what you see is that as you go from simple procedures to more complex procedures, the risk of minor complications and side effects often increases, and the risk of nutritional deficiencies increase as well. But with this, you get increased weight loss and a lesser risk of weight regain. Despite the fact that these are complex procedures, what you'll also see is that the chance of major complications for all of the operations remains less than 1%. So while weight loss surgery is complex and potentially risky, the risks can be kept under control if things are done sensibly and your surgical team is sensible and you are sensible. So what's next? Well, clearly the options are complex, and so there's a bit of a requirement for lots of face-to-face chats pre-operatively in order to make sure you make the right choice for you, and post-operatively to help you maintain your health while you lose weight, but then also to prevent weight regain, and weight regain can occur with all of these operations. We want you to come prepared with plenty of questions when you come in to meet the team.